Respiratory rate tells you if the patient is breathing normally or not. Respiratory rate is an indicator of a patient's recovery, and detecting an abnormal rate helps prevent an emergency. Taking respiration rate is very simple. You simply count the number of breaths your family member takes per minute. You can do this by watching the number of times a person's chest rises or falls, or by listening to their breath for 1 minute. You do not want the patient to know you are counting their breaths, or they will start breathing differently. 15, 16, 17.
What are you doing?
I was taking your respiration rate.
How do you do that?
By observing your chest movement. Each time your chest inflates, I make a count. If you notice me counting, you'll change your breathing speed, which is why I do it covertly.
Okay.
Remember that the normal number of breaths per minute is 12 to 20. If the number of the patient's breaths is not within range, do not panic. Simply call the nurse or the nearest doctor. How do you measure the breathing rate of the patient? Count every time the chest rises and the lungs are full with air. How long do you count the number of breaths? You should count the breaths of your family member for an entire minute. How often should you check the breathing rate? You should repeat this 3 times a day, in the morning, in the middle of the day, and before sleeping. Why is it important to make sure that your family member is unaware that you are counting their breaths? If your family member is aware that you are counting their breaths, they may change their breathing pattern. What is the normal range of breathing rate? The normal number of breaths per minute is between 12 and 20 breaths. What to do if the breathing rate lies outside of the normal range? If the number of breaths is outside of this normal range, immediately alert the nurse. If you are at home, you need to call the nearest doctor.